Hello, good afternoon, everyone. Good afternoon. I'm excited to be joining you guys today on today's edition of Sunday Chat with Dr. Madeline. So when you come on to the page, please feel free to send me a wave or just type your name into the box and let me know you're here so that I can welcome you personally. Thanks so much for joining me today. Thank you. Hello, good afternoon. Let me see, it looks like someone has joined us. When you join in, again, thanks for being here. Please, if you're able to, either send me a wave or chat your name into the comment box, and that way I can welcome you personally. Thank you for being here today. We're going to get started in just a minute or so. Today, we're going to be talking about vaccinations that are recommended in adult women. We'll be talking about vaccinations from age 19 to age 90. So I know we'll be able to follow up on some of the questions that you guys have asked in previous weeks. And so I'm excited to be joining you guys today so we can have this conversation. Please, as you tune in, please send me a wave or type your name into the comment box, and that way I know you're here. Hey, Lee, thank you so much for being here. Thank you. Hey, Michelle, thank you so much for being here. I appreciate you. Hey, Dr. Jamila, thank you so much for being here. Oops. I'm on my laptop today. I love this fall weather, so I figured I would shift my position and get some of that nice cool air. I hope you guys enjoy the fall too. It's a great season. It's my favorite season. It's one of change and watching the trees and the beautiful colors. So that's one of the reasons it's one of my favorite seasons. So again, thank you all for being here. My name is Dr. Madeline. I'm your board certified OBGYN, international speaker, and published author. I help busy women access GYN care and birth control on their time so that they're able to have more freedom and control of their lives and get the things done that they need to get done in a schedule that works for them. So please, by all means, follow me on all social media platforms. I'm on Facebook, Instagram, and Twitter as Dr. Madeline MD. That's DrMadeLinemD. So once again, thank you for being here. We are going to go ahead and get started. Today is kind of like a culmination of some of the questions that have come up previously in terms of what women need to think about for their immunizations. Can all of you hear me okay? Okay, thank you. Yeah, this is a different setup from my previous one, so I just want to make sure you guys can all hear me okay. Hello, Jackie. Thank you so much for being here. Thank you. I appreciate you being here. I'm sorry. I'll get the like and love buttons working soon. So once again, I'm Dr. Madeline, your board certified OBGYN international speaker and published author. And today we're going to be talking about, on today's Sunday chat, we're going to be talking about routine immunizations and vaccinations that are recommended for women. We're going to be talking about from age 19 to age 90 plus, okay? And that way, hopefully you guys will have all the information you need about what types of vaccinations you might want to discuss with your provider, what vaccinations you're on the ball with and you already have, and I'm happy to answer any questions as they come up as we're talking. Okay, so a caveat to this before I get started. So one of the other things to keep in mind is that these vaccinations are recommended for the general population of adult women. However, if you have any medical complications, if you have a history of heart disease, if you have renal failure, if you have for some reason either a spleen that doesn't work or you've had your spleen surgically removed, those are reasons to check with your provider about how your immunizations might need to be revised. And those are some of the high risk categories that for which immunization recommendations are often revised. Also, that includes chronic liver disease. It can include diabetes, Immunization recommendations are also different for healthcare workers, people who are consistently in a healthcare setting, whether it's a hospital or a clinic. Some other groups in which there are different immunization recommendations sometimes include pregnant women. Now, the reason some of these include pregnant women is because vaccines can either be live particles of the disease that you're trying to vaccinate against, or they can be like dead particles or inactive particles of the vaccine of the disease you're trying to vaccinate against. And pregnant women, you can imagine, we don't want to really give them live particle vaccines, right? And so any vaccine that includes live particles, we usually we don't give pregnant women. Pregnant women can get those after they deliver so that there's no risk of any problems with them or the baby. Okay. Now, one thing I always tell sometimes my younger women, especially sometimes I'll have women who are not thinking or planning of a pregnancy, but they might have a job scenario where, let's say, they're traveling a lot. They're going to places across the globe that require different types of vaccinations so that they can be as safe as possible when they get to those locations. It's always important to keep in mind, even if you're not thinking of children at that moment or in the future. This is important because at least in this country, the among all women who get pregnant, about 45 to 50% of those pregnancies are unplanned. And why do I mention that? I mention that because if you do have an unplanned pregnancy, it doesn't mean that you don't want it. It just means that you weren't planning for it. If you have an unplanned pregnancy and you have one of these careers where you have to travel and you might have to get some travel vaccinations, if you've already had these vaccinations done when you weren't even, thinking about pregnancy, then you're ahead of the game and you don't have to worry as much when you travel because that you have had the vaccinations that would be appropriate to have regardless of a pregnancy. And that way, if a pregnancy happened in the future, you would already be up to date with those vaccinations. And so that's always something that I share with my ladies. It's something that came up a lot. I used to work at CDC, and it would happen very often that if someone was about to travel, there might be a vaccine that is recommended they take, and if they were early in pregnancy, it would be challenging for them to be able to meet that travel requirement and take that vaccine, which is of course to keep them safe. Okay, so so let's go ahead and talk about what some of these vaccinations are. And I'm going to discuss them by age group because that's generally how we look at these when we're trying to break them down and make sure that you have as much of the information as possible. Now, I was smiling when I was preparing for this talk, getting the information together, because my son was laughing at me. So there used to be, back in the day, we used to have these yellow cards. I'm dating myself now. Maybe some of you who were in the chat boxes remember those cards. But it used to be that if you lost that card was what you would basically, your mom would carry with you to your pediatrician visit whenever you went, and that pediatrician would sign off whenever you got a vaccine. And that yellow card, literally, if you lost that card and let's say, 15 years later, you were either applying to a different school or maybe you wanted to travel, if you didn't have that card, it could be a serious situation because you had to basically show that card. It contained all of your evidence of all vaccines that you had ever had since you were a baby. And so I said my sons were laughing at me because they have no idea what this yellow card is. These days, thank goodness, all of the vaccinations that we get are kept in an electronic registry. And so those registries are kept by state. And so if when I go to my provider, if I end up getting a flu shot, it's electronically linked to a record that is tracking me by my name, my date of birth, probably another unique identifier, and that way all my information for my vaccinations is in that one place. And when they developed these systems a few years ago, what they did was pull in historical information as well. And so, based on what I gave them from that yellow card. And so it has stuff like, the vaccinations that I had when I was under 18, when I was seeing a pediatrician. And so that's a relief, right? Because keeping track of that yellow card used to be a challenge, certainly, when it was time to do some stuff. So let's start with age groups 19 to 26. Okay. The recommended adult immunization schedule for this is both women and men. Actually, they happen to not be different for most of the age groups for women and men. So the recommendation is that you have one dose annually of the influenza or the flu shot, the flu vaccine. That you have at least once a Tdap or a vaccine for tetanus, diphtheria, and pertussis, and then it's recommended that you have a boost every 10 years. And sometimes if people go in, let's say, and you may have seen this or witnessed this, let's say someone has a traumatic injury, they get their foot goes into a nail or something that's kind of old and rusty breaks, causes their skin to break contact. It's um, it's absolutely the case. Oh, oh, I'm laughing at Jackie and Lee. They still have their yellow cards, but it's absolutely the case that if that person can't document that they've had a tetanus shot, that they will get a full shot. If they've had a shot and they can document that it's been more than 10 years, then they will be offered a booster. Okay, so 19 to 26, it's expected that people will get a flu shot once a year, a Tdap if they don't have evidence of it, and a booster every 10 years. The MMR is the vaccine that's for measles, mumps, and rubella. And the recommendation is that someone get one or two doses depending on what's going on. Hi, Dr. Bobby. Thank you so much for being here today. I appreciate you. And Jackie, thank you so much for joining as well. So yes, the recommendation for that measles, mumps, and rubella vaccine is that you get one to two doses depending on the indication. Now, depending on your age group, many of us may have had some of these diseases when we were children. And so, if you already have antibodies for some of these things in your system, then it's not recommended that you get a fresh vaccine. So, these are things for which you have no evidence of immunity, okay, except for the flu shot that's recommended every year. Now, then when you get to HPV, we talked about this a little bit a couple of weeks ago. So human papillomavirus, the recommendation is that you can vaccinate your children starting at age 11 to 12 as early as age 9. But if you get to age 19 and you haven't had it and you want to get it, you can certainly get it recommended up to age 26 years. But if you guys recall, I said the FDA recently approved it for up to 45 years. So if you're 27 years old or up to 45 years old, and you and your provider, your clinician have had a conversation, and it looks like an HPV vaccine would be something that's beneficial based on your particular clinical situation, then the FDA has now approved that HPV vaccine to be used for women up to age 45. Okay? And so then we get to some other vaccinations that are potentially appropriate for you based on your situation. So I mentioned earlier that for healthcare workers, there are some other vaccines that's recommended we get because the idea is that whether we're in a hospital or a clinical setting, we can potentially be exposed to some things at an increased rate compared to someone who's not in a healthcare setting. And so that's when we get to, the hepatitis A vaccine. These days, hepatitis B is given when the babies are born, and just some other things that might be appropriate based on whatever your specific clinical situation is that you discuss with your provider. Now, the next age group, age 27 to 49, the same recommendation. Let's say someone is shifting and they're now interested in getting vaccinations. Let's say they've never had any before. So 27 to 49, the recommendation is still for an annual flu shot or an influenza shot every year. The Tdap, if they've never had it, if there's no evidence of vaccination, or if they've had it and it's been more than 10 years, that they get the booster. The MMR, or the measles, mumps, and rubella vaccine, if they are not showing immunity, or if they've never had it, then the recommendation is they get 1 to 2 doses. I don't think I must have skipped over this before, but the varicella vaccine. So again, varicella or chickenpox, that's one of the things that some of us may have had when we were younger children. This vaccine was available starting in like the 80s. And so for those of us who may have been born, in the 70s or 60s or earlier, we may have had chickenpox and therefore have immunity in our system and potentially not need a vaccine. But it's also the case that sometimes you can have the disease when you were a child and have antibodies, and then when you get to a certain age later on, those antibodies may have left your system. And so in those scenarios, it may indeed be appropriate to get a new varicella vaccine. Okay, but the recommendation is that from age 19, to 49, the recommendation is that you get 2 doses, especially if you were born at a time or if you don't have evidence of immunity in your system. And so that's for that one. And like I was just talking about for the HPV vaccine, the recommendation is 2 or 3 doses depending on the age of initial vaccination or condition, and 27 to 45 years depending on your one-on-one conversation with your clinician or your provider. Okay, so let's get to the age group of 50 and older. So from age 50 to 64, and actually I'm just going to say 50 and above. Okay, so these recommendations right now are for 50 and above, and if there's something different for 65 and above, I'll let you know. But we still recommend an annual flu shot. Okay, so the annual flu shot is recommended starting as early as 6 months of age. And so for women who have newborn babies, if those babies have attained 6 months, if they're comfortable, that's probably something they should discuss with their pediatrician, because the recommendation is that as early as 6 months of age, that baby can safely receive a flu vaccine. And that flu vaccine will help protect that child from 6 months until 90, 100 and older. Protect them if they were to be exposed to the influenza virus. It would protect them from having a more severe bout of infection. Okay. Again, the Tdap is the same thing, the tetanus, diphtheria, and pertussis vaccine. If there's no evidence of infection, regardless of your age, it's recommended that you get that vaccine so that you have some immunity. And again, I know we've all seen people who may have, accidentally cut themselves or fallen on a nail or somehow injured themselves. If there's no evidence of a Tdap vaccine in 10 years, then they get that booster. MMR, that recommendation for measles, mumps, and rubella actually goes up until about age 60. And after that, it's worth having a conversation with your provider to determine whether or not you're in a category or risk group that might warrant having that vaccination. Varicella, the same as previously, 2 doses are recommended, again, depending on your situation. Now, when I started, I mentioned that there are some chronic medical conditions that require that some of these vaccines be revised. The recommendations are revised. But again, that is based absolutely on one-on-one conversation with your provider. But again, if you have diabetes, chronic liver infection, if you don't have a spleen, if you have certain cardiac conditions, these things require one-on-one conversations with your provider to make sure that the vaccine is not something that's going to put you more at risk versus your natural immunity. Okay, and so then we those are the main things. So the one thing that came up in the last couple of weeks, and one of the reasons why I wanted to do this particular Sunday chat live on vaccines, is that there were some questions about the shingles vaccine. Okay, so the shingles vaccine is one of these things that's relatively new. A lot of people are sometimes not even aware of it. And one of the other things that has happened with the shingles vaccine is that they revised the recommendation from an older age of 60 plus now down to as early as 50. So for anyone who's at least 50 years old, the recommendation is that you get the shingles vaccine. So we talked a little bit about what shingles is, and shingles basically is a different form of the same type of herpes virus that was in your system from the time you had chickenpox. Okay, so those viruses are in the same family. Chickenpox and shingles are in the same family. And what happens is a lot of times that virus remains dormant in your system. And then when we get older, 50 plus, our immune systems change a little bit. And so you can have a bout with shingles. Now, shingles, if you've personally had it or if you've known anyone who's had it, shingles can be very painful. It's basically these little, these blisters that can form in what we call a dermatome. And that just means that it forms on a certain area on your body, on your skin. It can be on your lower back, and it can be upper back, and it can be front, lower part of your abdomen. But again, it's very, very painful. And a lot of times people have not only the blisters themselves where they have pain in that area, they can have body aches, their joints can ache. Sometimes they can have fever. A lot of times, and the shingles are also potentially contagious. And so people have to be at home and taking medicine to reduce fever if they have medicine, taking like Tylenol and other things for pain. And so shingles is one of these things that's very, very uncomfortable if you have a shingles outbreak happen to you as an older adult. So thankfully we have now the shingles vaccine, and again it's recommended that you get 2 doses starting at age 50, and those doses are usually about they can be up to 6 months apart. And for some persons, I think one of my doctor was telling me that if too much time passes between the 2 doses, you have to actually start over. So let's say it's been, and this has happened probably very commonly during the COVID pandemic, if someone got their first vaccine, let's say in February, and then everything happened with COVID and they haven't been able to get back in, that person would have to restart that vaccine series if it's been, 10 months since they had that first dose. Okay. And so, but what we know about the vaccine is that it does a great job of building up immunity and protection so that someone either won't have shingles, or if they have it, they would have a much milder form of shingles. Okay. And so that's a very important, relatively new vaccine that's out there and recommended for persons who are 50 and older. One other one that is specific for adults who are age 65 and older is the Pneumovax, or basically a vaccine that tries to protect against the different types of pneumonias that are more common in older adults. And so pneumococcal pneumonia is one that's very commonly present and can happen in older adults because, again, as we get older, our immune systems change, right? And so those cells that are normally in our body, that when we're younger, they have a lot more power in terms of helping us fight off diseases. And then as we get older, they don't have that same amount of power to fight off diseases and to help our bodies recover as quickly and as easily from some things that we can recover from as more quickly from when we're younger. Okay, and so those are the main vaccines that I wanted to cover with you guys. And again, there are some vaccines that are not recommended if you have certain medical problems. Again, with pregnant women, we can't give any vaccines that are live. Those tend to be there's a version of the flu vaccine that is nasal. Those we don't give in pregnant women at all because they have some live particle in them. We also don't give the measles, mumps, rubella vaccine or the varicella vaccine in pregnant women. So, hi, Sean. Thank you so much for joining. I appreciate you being here. And so those are the main vaccines that I just wanted to cover with you guys. If there's one that I mentioned that you're not sure that you have, write it down. What I'm going to do after this Sunday chat with Dr. Madeline, I'm going to take a screenshot of the table, which kind of summarizes the most common vaccines that are recommended for adults between ages 19 to 90. The chart itself, I think, says 65, but I say 90 to be as inclusive as possible because we do have some 90-year-olds that still are recommended to get their flu vaccine and to get that pneumococcal vaccine, or that vaccine to protect against pneumonia, in case they still need that protection. And so let me open up for questions. Okay, I have a question from, okay. Very good question. So when I first started this chat, I was joking some about the yellow vaccination book that many of us used to have to carry, that our moms or our parents or caregivers would hold for us, because literally it included every vaccination from when we were born until we were adults. And so Lee's question is, hey Sans, hey Arnett, thanks so much for joining today. So Lee's question is, can I check with the vaccination registry for the date of my last tetanus shot? my primary care physician of 30 years retired and I didn't record the date. So that's a great question. So it depends on whether or not your primary care provider transferred that information into the electronic registry when it stood up for your state. So if you're in the DC area, Maryland, or Virginia, one thing you can do is the next time you see your primary care provider, if you've already had your flu shot, or if you haven't gotten it yet for this season, you can ask them. You can say, "Hey, are you able to pull up?" So in Georgia, it's called GRITS. It's the Georgia Registry of Immunization, or something like that. Every state has a different name, but you can ask your provider whether or not they can access and pull up your state summary of immunizations. And if they pull it up and you don't see your tetanus shot in there, it probably means that your primary care provider may not have been able to transfer that information to the electronic record. This electronic record of all vaccinations, it's something that, like I said, has only been around like the last several years. And so there are many situations when I first was able to give my information to the doctor I saw when I realized everything had kind of shifted to the electronic process. I actually brought my yellow card with me, and we were able to, they were able to put in the information manually so that it could become a part of my ongoing electronic record. But I also had to have a booster in the last 10 years. If you don't have a memory, I would say, of having a booster for tetanus in the last 10 years, then I would say it's worth mentioning that to your primary care provider so that when you see them again, it might be appropriate. It might be time for you to get a booster if you have, no memory of it. But thank you for that question. That's a great question for many of the old school offices where everything was done on paper. And we're looking at a couple of things. Not only have immunizations gone a lot electronically, recently in the last several years, but so have a lot of medical records. So electronic medical records, I don't know if your primary care physician of 30 years had electronic medical records, but many physicians are just now kind of making sure they have that. It was something that was implemented and made mandatory when the Obama administration was in office. And many physicians, for a variety of reasons, some having to do with finances, haven't fully integrated to making their medical records electronic. And so, great question. Thanks so much for that. Hi, Catherine. Thank you so much for being here. I appreciate you. Okay. Any other questions about vaccinations, guys? Vaccinations for women from age 19 to age 90 plus. I intentionally didn't cover peds because pediatric vaccinations, for those of you who either have had children or been in a peds office when children are getting vaccinated, you guys know that there are many vaccinations that are recommended for infants up through those preteen and teenage years. And so that's a whole other conversation. And for that, actually, I would probably pull in or recommend one of my peds colleagues because they do that stuff like the back of their hand, so they know all those different pediatric schedules much better than me. So thank you. Let me see if there are any other questions. Okay. Okay. Thank you. I don't see. Oh, okay. So Catherine asked, "Well, hey, Esther, how are you? Thanks for being here." Um, we've been talking about vaccinations today, Esther, recommended vaccinations for women aged 19 to 90. Catherine just asked a great question. What do you think about the vaccine coming out for COVID-19? So, Catherine, that's a great question. We talked a little bit about that a couple of weeks ago, and I want to give an update based on the information that I'm aware of. And what's one of the good things about, even though this is kind of playing out in a very different way in the media and in front of us real time. That's happening because, oh, thanks, Michelle. Thanks so much for being here. Of course, that's happening because we're in the middle of this pandemic. And so, one of the things that's going on is that there are several pharmaceutical companies working on a COVID-19 vaccine. So some of those companies are in what we call phase 3 trials. Phase 3 trials mean that they've completed phase 1, where they basically were looking at a certain chemical makeup for a vaccine, and they tested it in a small way, in the lab, and it looked like it was safe. Then they did phase 2, which is where they had something that looked promising in the lab and with a small number of persons, and so they tried to enroll more humans to see how it would work, whether or not they would develop immunity, whether or not there were any immediate side effects that would cause them concern. And so when you hear people say on the news that we're now in phase 3 with many of these farm companies, it means that they are now trying to test the vaccine on many, many more humans, more adults, to see what the what immunity would happen in those adults. Also to see whether or not there are any immediate side effects. One of the things to keep in mind in terms of how vaccines are normally developed is that those trials to figure out whether or not a vaccine is safe and efficacious, or meaning it actually works, the way we anticipate it would work. One of the things that's different with this COVID-19 vaccine, that's the norm with many other vaccines, is that we have a longer amount of time in which we evaluate those vaccines for their safety. And so, we follow, usually vaccine trials follow people for years, because it's important to know, okay, what potential side effects are there going to be at 1 month? Well, what about at 3 months? What about at 6 months? What about at 12 months, 2 years? And that information is important because, as with anything that's new that we're looking at for the first time, we actually don't know what is going to happen, a year or two down the road. We don't know how someone might react to this new combination of chemicals that is going into their bodies to protect against COVID-19. So I say that to say that when and if we get to the end of these phase 3 trials for COVID-19, we won't have 6 months of data. We won't have 9 months or 12 months. Now, there are some people who say, okay, well, we're in a pandemic. So when you look at the risk benefit ratio, because COVID-19 is so deadly, if the early data looks good, if we have promising information at 3 months, it's worth going ahead and offering it to some people. So there are those who believe that. And then there are those who believe, well, I'm still not, that's not enough data for me. I need to see many more months of data, maybe a couple of years. I just need to understand more about what's going on. And so I think that one of the questions is, as you look at this information that's coming out, because it's playing out real time in front of us. So as you look at this information, which group do you fall into in terms of your comfort zone? You know what I mean? If you're looking at the information that they share and you think it looks reasonable at 3 months, that no one has had a side effect that they consider, quote unquote, serious enough to warrant not continuing with testing the vaccine, then you might feel that you're one of those persons who's comfortable getting the vaccine. There are many people, and I tend to be in this other group where but yes, I'm a board certified OBGYN, but I also worked at CDC for 21 years until 2019. And I think that there's value in this process of trying to have as much data as possible and not rushing things. I think that sometimes things can slip through the cracks if they're rushed. And while it is the case that we're in a pandemic and, the stakes are high here because the fatality rate with COVID-19 is so high. But I think in terms of what's going on, in terms of what I'm seeing and how the data are showing us that we can do some other things before the vaccine is ready, like wearing our masks and washing our hands and social distancing and and hand sanitizer and hand washing for 20 seconds or more. Those things, if you're comfortable doing those things and they're giving you protection and they're keeping you safe so far, then certainly it's not a bad thing to come down on the side of wanting to wait until there's more information. Now, Michelle said here, I hope we get to choose when we are ready to take the vaccine. Michelle, absolutely. We are in a situation where you get the right to choose. So there have been, so when this vaccine is ready, so you heard me talk about how usually the process to approve something takes years. So when this vaccine is ready, it would have to go to, they would have to take the data and send it to FDA, which is the Food and Drug Administration. And then the FDA would have to sit down with all the data and look at everything that they have available and study it. Sometimes they ask for more studies, sometimes they ask for more information. It takes a while for the FDA to approve something. So even if there's a COVID-19 vaccine that they say is ready in December, and maybe you guys have heard this phrase being used, emergency authorization use or emergency use authorization. That vaccine, if it is available, will probably be under an emergency use authorization because it will not yet have FDA approval. So I'm saying that, Michelle, to say that you should always have a choice when something is not FDA approved, even if it is FDA approved. We have in this country a sufficient number of people who are anti-vaccine, who are never forced to take a vaccine. That I don't think will change depending on what happens with this administration. We have different human subjects, things that go on. We have internal review boards. We have checks and balances that are supposed to be in place to prevent something like that from happening, Michelle. But I feel where your question is coming from, because what we've also seen in the last, months to several years is that there are people who are, how do I put this, who are navigating around some of those checks and balances. And so I do understand where that question is coming from. Yes, Michelle says, okay, great, good to know more about the FDA approval process. Yes, Michelle, even, you hear a lot of people talking about some of the COVID-19 tests that are out on the market and how many of them are rapid tests. Others are, they take a day or two to come back. One of the reasons why there's so many tests out there is because when some of the companies started working on the tests, it was kind of like an all hands on deck situation to try to get some tests out there so that the response to this pandemic could be a little bit better. But many of the tests that are out there on the market are functioning under an emergency use authorization. They're not all FDA approved. And so that's just something to keep in mind. That FDA approval process takes a long time, rightfully so, because there are scientists there who are really trying to look at all the data that are available, look at every case of someone having an adverse reaction, whether it's just a sore, being sore on the arm from getting an injection, or whether it's them having more neurological outcomes where they feel, weakness in their legs, or they have other signs that something more serious took effect. So yes, that anything that is developed will eventually have to go through FDA review and approval before it is made fully available to the general population. Okay, so thank you for those questions. Those were great questions, and I hope that I've shed some light on not only vaccines that are generally recommended for us, but a little bit more about the scientific review and approval process for the COVID-19 vaccine. Okay. Okay. Thanks, guys. I don't see any other questions in the chat box. And Esther has a question. Are all of the tests at least CDC approved? Actually, no, Esther. So what happens is, so there are times when tests are developed and tested at CDC, and then they kind of have these public-private partnerships where maybe if CDC does develop a test inside the governmental agency, and it's proven to be effective and all that, they may actually send it to a private company to say, hey, we've developed this, but we're the government, so we can't, like, do it for profit. So now you please work on, manufacturing this for more widespread use. With this, however, some of the early tests were attempted to be developed at CDC. Those tests were not functioning in the way they should have functioned, and so most of the tests that you see now on the market have been developed not by CDC but by different pharmaceutical and private lab corporations. Okay, so most of them are actually not CDC reviewed and approved, but that's not unusual. There are a lot of tests that are developed outside of a CDC. What happens is CDC usually tries to be a part of the process, or engaged with trying to make some tests, because ultimately a test that might be found to be effective, they want it to be developed in a way that is very cost effective, that has been rigorously tested in science. And that way, when a test is shown to be effective and cost effective, they can get it out to the general public as quickly and as cheaply as possible. And so, but yes, that's a great question. No, all of the tests are not CDC approved. All of the COVID-19 tests that are out there right now have been developed, and with some company. They've sent information to FDA, but again, because this was considered an emergency and such a highly fatal pandemic, many of those tests received emergency use authorizations, and they don't yet have full FDA approval. Okay. Catherine says she's concerned about the content of the vaccine, the RNA component that might change the DNA of a person's cells. A good point, Catherine. I haven't yet looked at the details of the ones that are on the final home stretch. And so, we'll have to look at some of that information when it comes out. I want to believe that those who are working on the vaccine are trying to work on something that's as safe as possible. Um, but I haven't seen the details of what they're working on. So that's a good point. As soon as there's available information about the components of the vaccine and which chemicals are in there, and what it's anticipated to stimulate inside a person's body to help them build up immunity, I agree with you. It will be important to look at all of that information, certainly before someone decides that they might want to get that vaccine. Okay. Thank you. Are there any other questions? I hope I've answered the questions that you guys have had. Okay. All right, great. Well, thank you. I appreciate all of you who have joined me today. I'm going to sign off for today's Sunday chat. I, again, just am thankful that you guys are here. And sign off, my name is Dr. Madeline. I'm your board certified OBGYN international speaker and published author. I help women access GYN care on their time so that they can have more freedom and control, and basically be able to manage and juggle all the things that are going on in their lives. Please follow me on all social media platforms, whether it's Facebook, Instagram, or Twitter. I'm at Dr. Madeline MD, which is DrMadeline MD. Thank you so much for joining me this Sunday, and you guys have a great rest of the week, and I'll talk to you soon. Oh, thanks, Lorraine. Thank you so much for joining. Thank you, Cheryl. I appreciate y'all being here. Thank you so much for joining, okay? I'll see you guys next week, okay? We'll probably dive in and talk some about breast cancer. October is Breast Cancer Awareness Month, and so I've gotten some questions about that, and we'll talk some about that next week, okay? You guys have a fabulous week. All right, take care. Bye-bye.